Thank you so much for this nice introduction. Okay. There may be some overlaps with the presentation of Dr. Vardis, because I will try to overview as sub-regions. Anyway, the economic crisis in Europe resulted in a decline in spending on public health in many countries since 2015. Since 2008. I want to reiterate what Ms. Susanna Jakob said at the Oslo meeting in 2013. In times of crisis, it's even more important that funding for health systems is protected, given that health needs can rise rapidly. And therefore, she called on governments, if you have to cut wisely, not broadly, and protect the vulnerable to ensure universal health coverage. So, what is the situation in Europe? In 2007, health comprised 13% of total government spending in the European region. Between 2007 and 2011, the health share of public spending fell at some point in 44 countries. It was lower in 2011 than it had been in 2007 in 24 countries. In 2013, only 20% of global health expenditure on diabetes was made in low and middle income countries, where 80% of people with diabetes live. More worrying than this, people living in low and middle income countries pay a larger share of health expenditure compared with those living in high income countries. Estimates indicate that at least $147 billion was spent on diabetes healthcare in Europe in 2013, accounting for more than one quarter of global health care spending on diabetes. By 2035, this number is projected to exceed $158 billion. But wide variations do exist in health spending on diabetes between European countries. Mean diabetes-related expenditure is over $10,000 in Luxembourg and Norway, but only $87 in Tajikistan. In 2013, as IDF Europe, we carried out a study on access to quality medicines and medical devices for diabetes care in Europe. This study highlights disparities in 47 countries of the IDF Europe region, articulated around three key dimensions of access to health care, namely availability, accessibility, and affordability. It provides evidence to policymakers and stakeholders on the current challenges faced by people living with diabetes. Diabetes medicines and devices were grouped into a total of 12 categories in order to maintain a certain level of comparability across subregions and countries. To help the analysis, these 47 countries were grouped according to subregional organizations and geographical proximity. I will try to give an overview about the affordability of medical devices in each of these subregions. Starting with Northwest Europe, all 15 countries in this subregion have well-established health systems and health coverage schemes based on their mandatory health insurance or national health services, which ensure the provision of and coverage of a set of health services. But they are subject to the application of specific requirements and evaluations as a method of cost containment. These vary strongly from one health system to another. It appears that the methods and policies used to set prices and reimbursement levels for medical devices are less developed and clear than those applied to medicines. At least 10 of 15 countries leave some of the cost of medical devices to people with diabetes or fully cover them for certain categories of people only, mainly people with type 1 diabetes or those treated with insulin. Therefore, access to medical devices for a large proportion of people, like people with type 2 diabetes, appears to be highly sensitive to people's ability to afford to pay for these supplies or manage their diabetes without them. Some countries have ensured a degree of flexibility by providing coverage where healthcare professionals identify a need for self-monitoring. All the countries in Southwest Europe provide some kind of financial coverage for diabetes medicines and medical devices. Strong disparities within the sub-region exist in terms of the public resources made available for health in general and diabetes in particular. Although most people with diabetes have limited out-of-pocket expenditure for their diabetes products, the coverage available in the sub-regions raises two issues in terms of affordability. In the countries where some co-payments are required, any out-of-pocket expenditure may be an issue for those affected by the economic crisis, while the limited coverage offered to certain categories of people, like people with type 2 diabetes and or treated with oral medications, leads to affordability issues in these groups. The coverage of self-monitoring devices and consumables is limited throughout the sub-region. Insulin injection devices and consumables, except insulin pumps, are also provided for free in almost all countries of the sub-region. However, the quantity may be limited. The coverage of insulin pumps follows specific criteria. Most countries in the sub-region appear to have protected the coverage scheme for diabetes since the economic crisis began, but the financial pressure on health systems has led to the introduction of new payments or an increase of fees for some or all of the people with diabetes. All the countries in Central and Eastern Europe have health coverage schemes. In the majority of countries, people with diabetes have to pay a share of their treatment out of pocket, and the cost covered varies a great deal. As a result, affordability issues were identified as a barrier to access to diabetes supplies in at least four countries, Bulgaria, Lithuania, Poland, and Romania. In Estonia, affordability seems to be a problem for many people with chronic conditions. Coverage provided by health systems appears to be more circumscribed for medical devices. Most countries either ration the quantities they cover or apply different levels of coverage to different groups, with children and young people often enjoying the best coverage. Injection devices like pens and syringes are partially or fully covered in 7 countries, while in Latvia and Lithuania, while other countries cover insulin pump. No, we are still on Bulgaria. Yep. Neither Bulgaria nor Latvia offers any coverage for insulin pumps and consumables, while other countries cover insulin pump therapy primarily for children. As for self-monitoring devices, all countries in the sub-region offer apparently some coverage for blood glucose testing devices. However, 4 of them do not offer any coverage for ketone test strips. Additionally, all countries in the sub-region limit the quantity of consumables covered depending on the recipient's characteristics, for example, age, treatment regimen, and pregnancy. Hungary, Bulgaria, and Romania cover blood glucose monitoring devices only for people on insulin. These different coverage criteria are additional to the existent prescription criteria in that country. The Southeast region shows great variety, and affordability was reported as the greatest challenge to access to diabetes supplies throughout the sub-region. Most of the countries provide selective coverage for self-monitoring devices and insulin pumps. This varies according to type of diabetes, treatment regimen, complications, pregnancy, or age. Again, children and young people usually enjoy the most generous coverage. Apart from Israel, all countries offer at least one type of insulin and injection device free of charge. Israel's health funds cover most of the cost for both. Most countries also limit the quantity of consumables covered for each category of people. Only Albania offers no coverage at all for self-monitoring devices. These different criteria for coverage are usually, again, additional to the prescription criteria in that country. Eastern Europe shows some of the highest and lowest diabetes prevalence rates in the European region, with about 10% in Russia to 2.8% in Republic of Moldova, Georgia, and Azerbaijan. The affordability of healthcare is a serious issue across the sub-region. The capital and resources for health available to each of the countries in Eastern Europe differed greatly from one country to another, as did the constraints on their health systems. So affordability appears to be among principal barriers to access in at least 7 countries. The list of medicines and medical devices that receive some public coverage varies a great deal from one country to another. In general, medical devices seem to have lower coverage. Fewer countries offer financial support for devices, and those that do usually cover a specific group of people only. Insulin pens benefit from some kind of coverage for children, at least in 7 countries. Overall, children and, in some countries, pregnant women tend to receive more comprehensive coverage. Belarus and Uzbekistan have also implemented measures to provide further financial support to people with low incomes and registered as disabled. Nevertheless, it should be kept in mind in all the countries in this sub-region, people with diabetes are one of the few categories of people that can benefit at least some kind of support from the public health system for outpatient medicines and devices. While the European region includes some of the oldest health systems which have achieved nearly universal coverage for their populations, it also includes health systems and health coverage schemes in transition and development. There are wide disparities between the diabetes prevalence between the countries in Europe, and so the burden the disease represents and the level of priority it has on the political agenda. These factors inevitably has an impact on access to medicines and medical devices that people need. Thank you.